Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. Have a very, very special guest, the author of this book, Unlocking the Secrets to the Hypermobility Puzzle, Dr. Marcia Perretto. So thank you so much for coming.
Thank you for having me.
And then Dr. Perretto was one of the first people that I contacted when we set up Caring Medical Florida. So you have a specialty interest and are one of the world experts, I would say, in Ehlers-Danlos syndrome. So if you ever wonder, who does Dr. Hauser refer to patients to? And one of the physical therapists, doctors of physical therapy that I refer people to is Dr. Perretto. So thank you so much for being here. Why don't you explain where your practice is and how did you get into specialty, being a specialist in hypermobility disorders and Ehlers-Danlos syndrome?
So it always started with me, actually. I had multiple hip surgeries and up in disability. No one knew what I really had, except that I wasn't healing accordingly.
Yeah.
And there was something wrong with my collagen, and just because I was in disability, couldn't work, and I just ended up researching. I went into the research, figuring out what were the possible collagen disorders that could cause what was happening to me, and that's how it all came down.
When was that, in your 20s, or when did you have
No,
those
I
things?
actually officially didn't get diagnosed until I was 40.
Oh, okay.
And my first surgery was at age 38.
Oh,
And
okay.
that's when things just literally failed right off the beginning.
You were already a physical therapist then, right?
Yes, I was. Ironically, I was a hip specialist.
Oh, in Florida, or where?
Yeah, no, here in Florida.
Okay.
Yes, I worked with the Renown Orthopedic Institute back then, and
Okay.
yes.
So tell us about your practice and where is it located and what is it called?
So, Actify Physiotherapy and Wellness. We are located in Boca Raton, Florida. It's a practice 100% dedicated to patients with connective tissue disorders, Ehlers-Danlos syndromes,
Okay.
and hypermobility spectrum disorders. And I've been there since 2013. It's our 10th anniversary now.
Oh, awesome.
Yeah.
Congratulations.
Thank you.
And then what made you decide to write a book on the hypermobility puzzle? And why do you call it Unlocking the Secrets to the Hypermobility Puzzle?
So I wrote this book along with my partner, Dr. Marlon Pereira from the University of Miami, and him and I was just finding that it was very difficult to for the patients to correlate all the symptoms. Everything was always in physical therapy, either to focus on musculoskeletal part of only,
Okay.
and exercise and dislocations, subluxations, and controlling that. But there are all the components of POTS and mast cell activation syndrome, and what happens if that patient has craniocervical instability, and what about the fatigue, and what about the exercise intolerance. So we wanted to make a book that was small, concise, but with all the
Okay.
key informations into those topics, along with the exercise prescription.
I often say that most of us in alternative medicine or go off the beaten path, it's almost always to get ourselves better, because again, like I had a really bad car accident when I was 14 with my father, and that, ended up getting neck problems, and then in 1992 got prolotherapy. So it's always interesting to hear like the things you've struggled with. So maybe you just share a little bit, like, have you had POTS, have you had all these things, and then how did you figure out how to help yourself?
When I had the surgeries, right after the second one, I literally had all the symptoms to come up to reality, let's put it this way. Before I was hiding the whole thing. I was like, oh, everyone gets dizzy, everyone has pain all the time, right? I think it's the reality of the EDS patients. And when I really had the second surgery and went into the third one within 7 weeks difference, POTS symptoms and mast cell activation syndrome, all those symptoms started, digestive issues, couldn't digest anything, couldn't tolerate anything, slight sensitivity, inability to stand, all that just kind of was set loose with the procedures, which is it's a trauma now, right? We understand that through epigenetics, that can actually set off all the symptoms, and that's what I came down to experience. Unfortunately, no one knew I was that. Everyone it literally even thought I was faking the whole thing just to stay on disability. And so it took me, myself, to go researching, put my knowledge to work first to myself to figure this out. And it kind of became a path to help others.
So say somebody had POTS, mast cell, headaches, dizziness, vertigo, what would you recommend they do? Like, what would you?
So the evaluation that I do with them
Okay.
is 2 hours long.
Okay.
I go through the details of their history. I'm interested through everything that has happened, even through the triggers that when they started having more symptoms and what happened in their life at that time. From there, we go into a physical, we do a computerized postural assessment. And then from there, we go in through a whole body examination. On that, I will be checking all levels of the spine. I will be checking craniocervical. We're going to do orthopedic testing. We're going to check shoulders, elbows, fingers, hands. We go through the entire body. From there, we go through recommendations based on POTS, if there's POTS symptoms present, mast cell activation syndrome, exercise intolerance. I will gather all that information, and then that goes into the prescription of the exercise based on like how much POTS symptoms you have. Okay, we have to start you on this position versus on that.
Okay.
If you have exercise intolerance, we'll have to downgrade that exercise quantity and dosage in
Okay.
order to address their needs.
So say somebody lives in Florida, so you do the initial assessment. How often are you normally seeing them? Like, what would be ideal if somebody was able, to get this service? Like, how often would you recommend seeing them for somebody who's really struggling?
So the majority of the patients come once a week.
Okay.
The reasoning
Okay.
behind the once a week is because we actually want them to do their home program, which is prescribed,
Okay.
designed for each person.
Okay.
We want them to be able to participate on those exercises daily, observe their symptoms, journal their symptoms so we know what is happening. And they keep in touch with us at the clinic. So even though they're not in the clinic, we are receiving their messages, emails, telling us how they are doing. The app with the exercise allow them to communicate with us how they feel with each exercise, and we monitor them through that.
Great.
So usually they will use anywhere from 20 to 40 visits over a year to a year and a half because they need time to heal.
Yeah, that makes sense.
Right?
That makes sense. You know how, like the clinic here, obviously the ideal thing would be somebody, lives in Florida. But then, of
Definitely.
course, because it's so specialized, there's not a lot of physical therapists that specialize in Ehlers-Danlos syndrome or hypermobility disorders, that sometimes you change it just because, like, say somebody was from Europe and they wanted to see you and they're just going to be here for a month, 2 months, 3 months, they still could see you. And do you ever see people like every day? Like, say somebody was just going to be
Yes.
here for like 2 weeks, like they're from Norway, and say they
Yes.
wanted to see me and they wanted to see you.
Yeah,
So.
we have what is called the 2 and 3 week retreats.
Okay.
Right? So they will come in anywhere from 2 to 3 hours a day, but that is not only exercise. Obviously, no one can tolerate that. So that involves education, that involves teaching them how to get by their daily activities. Because it's not only telling them get stronger, it's not about only strength. It's about learning how to manage the day-to-day activities.
Right.
And how to get by, how to structure their day even so they last through the day without hitting the wall about 2 p.m. and then not able to interact with the family or not being able to do anything else.
Do you get involved with diet and other aspects of
Yes.
their care?
Yes.
So why don't you just talk a little bit about that? So obviously there's the structural component, but then there's like lifestyle.
Well, yes, lifestyle is critical, right? So that was one of the first things that I had to change on myself. I'm actually a health and nutrition coach as well. So that it was all coincidental. It was like I was guided to be where I was, Like it was a blessing in disguise to go through my health issues because it showed me what I needed. I'm constantly improving in what I do, but nutrition is key. You
Okay.
have to heal from inside out. Now, when you get an Ehlers-Danlos patient or patients with digestive disorders, if they are not absorbing, if they are not digesting, if they're not tolerating foods, those foods might be key for their healing.
Okay.
So then there is the adjustment part. Okay, how we are going to do this? What is the best diet for you to be on? What are the best supplements we can have you discuss with your physician for you to be able to take to support your process of rehabilitation? So it's not just go there, do a couple exercises, and feel better, right? It takes a healing from inside out.
Oh, that's great. Do you ever do like just an initial interview or something, or a consult over,
The phone.
Zoom or
Yes, we have the phone
Okay.
interviews consultative where we explain everything that's gonna happen and how it is. And if it's needed, I will do, depending on how that consult goes, I might get on the phone with that patient because we want to make sure that that person is ready and we are the right fit to help them. Because I would not want someone to go out of their way, fly across the country like many do, and get there and we are not the right fit. So we make sure that that person we are the right fit to help them. They are on the right health stage. And it doesn't mean they have to be better in any state. I have people really, really sick. It's just they need to be at a certain level of testings and things like that so we can help them.
Yeah, well, they have to be able to, come to the clinic and, like same sort of thing here. Like we'll have people contact us and they're on IVs and they have a feeding tube and, you just got to make sure it's actually safe for somebody to come here, just to come to Florida and everything.
I always say that tolerating the trip is probably the hardest part because there are hours in a car or hours in an airplane, and all that can flare symptoms. So that is a huge one. I also do consulting to therapists outside the state.
That's good.
So I get online along with the therapist at the time of the patient's session, and we go through some testing and evaluation, and then I do the consulting over the plan of care for those patients as well.
Say somebody has some instability, do you teach them, well, obviously most of the people have instability. Do you teach them about taping or bracing, or so you're probably pretty much an expert on that also?
Yes, so taping, depending on the skin tolerance, right? A lot of us have a lot of the issues with the skin, so the tape can rip the skin open. We go through that, or we go through soft bracing with compression garments, through hard bracing if necessary, and there is a place for everything. I'm very conservative when it comes to putting hard braces because those can actually take away from the muscle and the active support of the joint, right? We don't want that to happen, but as needed, we'll be using that. We go over compression stockings, compression pants for exercising, compression tops, which is one of the ones I have on today. Compression socks, it's the 3-level compression for the pots. We go through everything they necessarily they will need for their day-to-day based on how they feel that day.
Let's say somebody thinks they have Ehlers-Danlos syndrome. So could you, at your clinic, figure out whether they have Ehlers-Danlos syndrome?
So as a physical therapist, we are not allowed to officially diagnose this, but obviously I will go.
You could.
I could.
Yeah. I
so
got
what I go through, I go through the criteria, but I go through other testings too. I do have patients that don't hit the criteria, but unfortunately have so much more instability in these locations to joints, they're not part of it, right? So I'll do the full body examination, and then I will do the referral based on the needs. So let's say someone has not been officially diagnosed, I will explain to them, just like I told you, I will refer you to physicians that can formally diagnose you. We'll send then either to cardiology or electrophysiology. We'll send to genetics. We'll send to GI, especially. So I had a broad network of physicians. I'll send to you, right? Depending of the needs of that patient.
Yeah. Can I ask you something?
Sure.
This is just for my own knowledge. So say somebody, they're not on any medications or anything, and then they're watching this and they're like, they want to start out with the most conservative care. So obviously your care is going to be a lot more conservative than doing prolotherapy and all the joints. Do most of the people, if they came and they saw you first, do you think in general, I'm not just in general, do you feel like with all the knowledge you have and you teach somebody and they're the ideal candidate for you, do you think you can get them to do their activities and not need medications?
Well, depending on the case, obviously, some will come to us on a lot of medications, and eventually they're feeling well, and with the help of the physician, they peel back those medications and will be only on supplements at a certain point. Some will come in without any supplements, or maybe the wrong supplements and no medications at all, just over-the-counter things they try to medicate themselves. So then we're going to look at the needs they have, and some of them just with diet, changing diet, lifestyle, educating them on the right foods and the specific diets they might need. They might not need to go on medication. Obviously, this is not for everyone, though. There's a place for everything, right? Sometimes the medication will be something that is needed temporarily, so we can level the patient and then back it off. But yes, there is a place for everything. Some patients don't ever need to be in medication.
Have you needed medications or not? Like, because you've had...
As a patient, yes, I have needed medications. I have been on several throughout the years, and then as I improved and got better, so I started, like, my first goal was to get through Publix shopping for groceries.
No, but that's just being honest.
Exactly. I just wanted to be able to get in, get out with 2 bags of lightweight stuff, and then next goal was going through Super Target. Next goal was IKEA store, and now I'm actually running. I'm gonna do a 10K. I'm gonna do the Disney 10K in January. So it's possible.
So you have a full life pretty much.
I have a normal life, yes. It's knowing when you wake up, sitting down in the morning on your chair and saying, okay, how much energy do I have today? What I can take on? How does my agenda look like? Can I embrace all this? Or I didn't sleep well, or I ate something I reacted to. What do I have to remove from my agenda today, because I'm not going to get through it all. So it's really being, checking in with yourself and being realistic.
Honestly, that's really something everybody should do. Like, when we started today, because my energy's a little bit low, because I've had just a really busy weekend. Really, it's something that we all should do, because somehow we all think like we can do this, that, and be super person. And it's just every day's different. Like some days you wake up with a lot of energy. So that's interesting that you would say that. So what would you recommend, like say somebody, they come across this video and they're kind of hopeless. Like what would they just feel terrible. All they know is like they're completely exhausted all the time. Their brain's not functioning and nobody seems to know what's wrong. So what would you recommend they do?
Finding the specialists that understand the illness is key, right? Because it's not.
So what would you say would give them clues that they have Ehlers-Danlos, or that it's clues that they have like joint instability? So what would they look for?
Well, you're extremely flexible in general. You're being told you're double jointed your entire life. You're the life of the party, doing tricks, right? Bending your elbows backwards.
Were you able to do some of those things?
Oh, yeah, pretty much everything. I would go, I was maybe like 11, 12, 15 as I danced, and I figure skated for a long time semi-professionally, because my energy level would never let me get to any higher level of skating because I didn't know what I had. But I would go down a split and I would be on the floor just kind of watching my friends struggling to split, and I'm like, why is that so difficult for them? So like your hands like very flexible. You have difficulty holding things, a lot of neck pain. Do you feel your feet purple as you sit down for too long? Are your knees unstable? Are you clumsy? Are you tripping over things they're not even there, right? Clunking and clicking joints, painful or not. All these are clues, right? And then the dizziness, the brain fog, digestive upset, well, no one is supposed to be living with either nausea, constipation, diarrhea, or acid reflux all the time. There is something wrong. But, you know, finding the person that can put all the symptoms together is the
Okay.
key.
That's really
Right.
good. Now you sent me a few things here, so why don't you, can you just explain a little bit about this? Like, this is actually at your clinic, right?
Yes, so this is
So you
at
have
the
some
clinic.
specialty equipment at your clinic?
Yes,
Yeah.
we do. So that's a Norwegian equipment. That's the red cord. I am fully certified on it. The beauty of the red cord, it allows me to unweight the person and truly see where the faulty mechanisms are at. So if and also it is a form of strengthening with that much more gentle to the body
Okay.
versus weights and bands and things. Not everyone tolerates that, and of course not everyone starts on that position right there. Well, this is just like the book, the promo for the book. So now we also offer small group classes. They're specific for hypermobile bodies.
Oh, that's interesting.
So we offer yoga for hypermobile bodies, Pilates for rehabilitation, for tailored specific for hypermobility, and we have the POTS program, the hypermobility program, and then we design it based on the patient's, if the patient has mast cell activation syndrome, exercise intolerance, the classes are all designed around that. And we also have our signature classes called movement integration, which is where we integrate all the theories of exercises that exist, because I don't believe one thing is good.
Yeah.
I believe everything has good in it, and if we know what that person needs, we can pull from the toolboxes we have, and put together a Pilates, a yoga, or whatever
Perfect.
it's needed. And then the traditional Pilates, the reformer, and we have the Cadillac, the chair. But they're all part of the day-to-day exercises tailored to the patient needs. So.
Marcia, if somebody wanted to, or Dr. Perretto, if somebody wanted to contact you, what's the easiest way for them to contact you?
So they can text or call the clinic at 561-366-2435. They can also go to our website at www.actifypt.com and message us from there. Or they can even contact us directly from through Instagram. They can find me at @the_EDS_PT, and we are very responsive. We'll get back to them really quickly.
Thank you so much, and just hope you have an amazing day here of learning at
you.
Caring Medical, and just great to have you here.
Thank you for the opportunity, and yes, it was great being here.